We needed to refresh the carers and confidentiality policy because we refresh them from time to time anyway, but we decided to take a much deeper approach to it and use co-production to refresh it. Part of that is we really want to understand what the barriers to people understanding confidentiality is. It's not an easy subject, and bringing carers in, involving staff, to understand it from all perspectives, we think is going to make it more effective.
Janice and I met as the family and carers lead, and we started thinking about what it is that we need to update in the policy. And as we were having a conversation, we thought we don't necessarily have all the answers. Yes, we can update, the legislative context. We can change the terminology to make it more topical, up to date. But what we can't do is we can't input the perspective of the carers. And that is what we were struggling with. And so in the name of co-production, that is what we did. We went back to ask the relevant group, which is the carers group.
Points that I thought were really important were regarding about what is confidentiality and regarding sharing information and the information about consent as well.
Confidentiality is really important when we're thinking about how we work with carers, because the organisation must be thinking about carers as our partners and collaborators in providing care.
We don't have the answers. We learn all the time from each other, and asking our service users, asking our carers to let us know and get that feedback is so important for us to make sure that we maintain a good care for everyone.
The focus groups were quite dynamic in the way that people put their views across, and me and Jacqueline found ourselves at times playing referee in the groups. But to me, that's passion, isn't it? That's about wanting to be heard as carers and feeling unheard at times within our trust.
Exploring confidentiality, increasing both, my understanding, other family members' understanding, and also giving staff more confidence in their understanding of confidentiality, so that they can handle difficult conversations, I think is incredibly beneficial both for staff and patients, but also for delivering better health outcomes.
It matters to me as a carer, and it did as a staff member as well, because to me the doctor-patient relationship is a sacred one. So what happens in the room stays in the room.
It's great to think about what's the difference between confidentiality solely with patients and when you include the carer. So when you include the carer, you get a triangle of care. So you have the service user, the carer, and the staff. And the staff will hear different information and give different information to each of those parties. But the carer and the service user may also give different information to each other. So there's a lot to negotiate in there. That's why we're trying to give much clearer advice so people can handle that sensitively and just create better care whilst protecting people's rights to privacy and have their own information delivered in a way that they're happy with.
I wasn't aware of all the ramifications and how complex a subject it would be, because people work at it from a sort of, shall I share this information or shall I keep it confidential point of view. But I think if you work from the start as thinking this is confidential, what do I share, you might find it easier to work as a staff member. And of course, as a carer, it's sensitive. All your information is sensitive. You don't want it sort of spread to everybody. So it's about respect.
The confidentiality handbook will really come in handy as a checklist for carers to think about how they ask for information and how our staff can share that information with them.
So I can think of occasions where if a conversation had been handled better, if information had been shared, particularly across organisations, not just within one trust, there would have been a faster and better health outcome for all concerned.
I'm hoping that we are on the right pathway. We spend a lot of time to do some thinking around confidentiality and think in different environments and in different settings what confidential would mean and how we secure that we keep the confidentiality for family members, for our service users. It is a complex issue, but I think one of the issues is that we need to have the conversations and not be worried about asking